Hello, my name is Dr. Brooke Rossi. I am an infertility specialist at Ohio Reproductive Medicine in Columbus, Ohio. For Infertility Awareness Week, we are doing special sessions for our patients and for patients all around to help them understand different issues related to infertility. Today, we'll be talking about the top 5 things that fertility doctors would like patients to know about infertility. There are 2 different things to understand about ovulation tracking, and this may influence how we do it in the office or how it is done at home. So, the first is to ask, are you just trying to understand if ovulation is happening? And then the second is to try to understand when ovulation is happening. Some of the best ways to understand if ovulation is happening can be very simple. For example, one of the best ways to check for ovulation is to just do a menstrual diary. And this actually helps patients understand sometimes things like when they're ovulating. It also can help their providers understand when they're ovulating as well. Usually, we'll say that cycle day 1 is the first day of heavy menstrual bleeding. And then the last day of the cycle would be the day before the next bleeding occurs. Usually, when patients are having periods regularly or periods about every 25 to 35 days, they are most likely ovulating. Now, some of our other patients, for example, patients who have anovulation or conditions like polycystic ovary syndrome, they may find by doing menstrual diaries or tracking with an app on a phone that they have longer cycles and they may not be ovulating regularly. Sometimes patients will also do something called a serum progesterone level. That usually means checking a progesterone level in the blood work about a week after they suspect ovulation has happened. Sometimes in the office, we call that a day 21 progesterone. We say day 21 just because usually people ovulate around day 14. But in fact, what we're trying to do is to get the idea of what the progesterone level is about a week after ovulation. Usually anything above 3 or so indicates ovulation. It doesn't necessarily tell us about how good the ovulation is because progesterone levels can kind of go up and down throughout the luteal phase. Another way to check for ovulation is something called basal body temperature checking. And that is done with a special thermometer to look for a small increase in the basal body temperature or somebody's temperature after ovulation. Progesterone is a hormone that can slightly raise a person's body temperature. And so if a temperature is checked with this special basal body temperature, a few days after ovulation, a person may see an increase in their rise in progesterone. So those different forms of testing for progesterone tell us if ovulation has happened. For some patients, they are trying to figure out when their ovulation is going to happen because they're trying to target when to have intercourse or when to do other treatment to increase their chances of conceiving. So some patients will do urine ovulation testing at home, which tests for a hormone called luteinizing hormone in the urine. That's prospective, meaning that if you get a positive ovulation test, you can then either plan to have intercourse or plan to do an insemination to help increase the chances. Sometimes also within infertility treatment, patients will do something called ultrasound monitoring, which is when we will do a transvaginal ultrasound in the office a few days before we think ovulation may be happening. And then sometimes patients will also even take a medication or something called a trigger shot to help ovulation occur at a specific time. So these are all different ways to check for ovulation. Sometimes patients find that checking for ovulation at home, sometimes that can be really stressful. So I think it's important to talk with your provider about if it's helping you or if it's becoming more stressful to be monitoring for ovulation. So the fertile window is the time in a person's cycle when they are most likely to conceive. Now, it's a little tricky because ovulation happens about 12 to 14 days before the patient's period. So it's a little hard when you're sitting there on day 1 of your cycle to try to figure, you don't know when the next period is going to happen. For most people, the fertile window happens sometime between day 10 or 20. Specifically, most studies tell us that the fertile window is 6 days before ovulation, and that the 2 most fertile days are probably the day before ovulation and right around the day of ovulation. But sometimes when people have longer cycles, like if a person has a 35-day cycle, they might actually be ovulating more around day 21 or so. Sometimes when patients have shorter cycles, they may be ovulating closer to day 10. So although the textbooks sometimes tell us that patients all ovulate on day 14, we know that's not true. So sometimes helping to understand when you're ovulating helps to understand when that fertile window is. One question that we get quite a bit is when to have intercourse in the fertile window. Most studies would suggest that having intercourse about every 1 to 2 days during the fertile window is sufficient. Sperm usually live in the genital tract for about 1 to 2 days. So if patients want to have intercourse every day, that's fine, but usually every 2 days is sufficient. We often get questions from patients about what they can do to help with their infertility. Many of the factors related to infertility we don't have any control over, and neither do the patients. These might be things like age or other factors that we can't change. So patients are often trying to say, well, if I can't change this or that, what can I actually do to make a positive difference in my chance of conceiving? So a common question is to ask, what about diet? In general, there aren't any very clear guidelines from diet studies about what is right to eat or do when you're trying to conceive. In general, I think that trying to have a healthful diet is usually a good idea. So that would be things like trying to limit high sugar foods, highly processed foods, trying to make sure that you're having a balanced diet. Fruits and vegetables, good proteins are probably beneficial for overall infertility. Many of our patients also use exercise as a way to help reduce the stress associated with infertility or infertility treatment. And the good news is that most fertility treatments are not affected by exercise and may even benefit from exercise. So if you're doing a regular exercise program, whether it be running or jogging or walking or yoga or strength training, that's usually fine to proceed with while you're doing infertility treatment. It's probably not going to hurt anything, and it may even help. You should always ask your provider if they have any concerns if you're doing any significant exercise, but usually exercise has not been proven to hurt anyone's chances of conceiving or, again, may even be beneficial. In terms of supplements and vitamins, it is definitely recommended that patients take a regular prenatal vitamin. And specifically, we would like patients to take prenatal vitamins with at least 400 to 800 micrograms of folic acid. In terms of other sort of things that people can take, such as caffeine, alcohol, smoking, that sort of thing, we'd like patients to limit, this probably goes for specifically for our women patients, to try to limit caffeine to no more than 1 drink per day. And when we say drink, we mean about an 8-ounce glass of a caffeinated beverage. The alcohol data is kind of mixed. I would say that for women, we try to have them make sure they're not drinking more than 4 drinks a week. For men, probably somewhere between 4 to 8 is allowed. And then once women conceive, we don't want them to have any alcohol. And sometimes even sort of when women are in treatment in that 2 weeks between when they ovulate or when they find out if they're pregnant, or during IVF after the embryo transfer, we definitely would not recommend any alcohol use because people could be pregnant during that window. Some people may not know anyone who has infertility, and therefore they don't understand the prevalence or how many people have infertility. Infertility is actually quite common, and unfortunately, it is becoming more common as time goes by. Currently, the risk of infertility is about 1 in 6, which is about 15 to 20%. Within the population of patients who have infertility, about a third of it are issues related to women. So those may be things such as anovulation, endometriosis, or issues with the fallopian tubes. About 10% of infertility is considered infertility related to the sperm. So it may be poor numbers of sperm or poor quality with low motility. And then it's also very common to have multiple factors going on. So for some of our patients, it may be issues with the sperm or issues with related to women, or it may be unexplained infertility as well, where all of our testing is normal, but patients are still having difficulty conceiving. It is recommended that patients see an infertility doctor for evaluation and treatment if they are less than 35 years old and have attempted pregnancy for 12 months. Now, if patients are 35 or older, we should be seeing patients if they've been trying for at least 6 months. Now, it's important to understand, though, that that 12 months is only for patients who are having regular cycles and don't have any known risk factors. If patients are not having regular cycles and there's a concern for anovulation, or if they have any history that may be concerning for fertility, such as significant pelvic surgery, endometriosis, a history of surgery on their ovaries, cancer treatment. And I've had a couple patients over time who have told me that a physician has told them, "Oh, you might have trouble getting pregnant." Anything like that. Even if you come and see the provider early so testing can be done, I think it's better to just see someone and get your questions answered than to wait. Thank you for listening to our question and answer session for Infertility Awareness Week. We hope that you are taking care of yourselves and others around you, and we are here to offer support to you as well.